Hi everybody, I'm Dr. Tina Marcantel. Today we're going to talk about leaky gut syndrome. We're going to talk about a healthy intestinal function versus a compromised intestinal function. And we're also going to talk about food sensitivities. When clients come into my office, I give them this illustration and I'm going to talk about it today with you. Here is an example of the healthy intestinal function. Here's representation of the inside of the intestines. You have food in there, bacteria, toxins. It is not sterile at all. Here you have what's called the mucosal lining, the intestinal lining that separates the blood circulation and brain from the intestines. Of course, this is just a representation. So the circulation is sterile, whereas inside the intestines it is not. So we have this lining that is separating the two compartments, preventing any bacteria or toxins from getting into passing the blood-brain barrier into the brain and also in the circulation. The intestinal barrier filters nutrients to the body and prevents food toxins and bacteria from entering into the body. So this is a healthy intestinal function. Here is the compromised intestinal function. Here again, you have inside the intestines and you have the mucosal lining. You have also the representation of the bloodstream. What happens along this mucosal lining, there are certain foods or particular conditions as stress, which causes a whole cascade of chemicals which causes inflammation along this mucosal lining. So certain foods may cause inflammation along the mucosal lining, also stress, and also certain diseases such as autoimmune diseases. In particular, I see a lot of people with Hashimoto's thyroiditis, and that is inflammation. So anytime we have inflammation along this lining right here, it causes those junctions to separate, and it allows what's in some of the things that are in the intestines, being the bacteria and toxins, to go through this mucosal lining and into the bloodstream. The breakdown of the intestinal lining that allows the food and toxins and bacteria to enter the bloodstream results in widespread inflammation, including in the brain. Systemic inflammation may manifest as these signs and symptoms. First of all, digestive issues, abdominal bloating, IBS, gas, cramping, diarrhea, constipation, even GERD. These are some of the digestive issues that may be a clinical presentation. Concerning the skin, eczema, acne, dermatitis. Systemic inflammation may also affect the respiratory system with bronchitis, asthma, and also even sinusitis. So there are quite a number of symptoms here that we want to watch out for. Respiratory, keep these three in mind: respiratory, digestive, and the skin are the three big ones. And if you want more information about the digestive system, you can go to our book, Chapter 6, in Imagine a Whole Different Kind of Medical Care. Or you can go to drmarcantel.com, our website. Thank you for listening.